Hey everybody, welcome to Module 2 on the Protected Sleep Core Measure. As you remember, Module 1, we just presented an overview of what is sleep, gave you a little bit of the facts behind some of the implications of sleep deprivation and the importance of sleep in our health and everyday wellness. Today's module is really looking at sleep and the healthcare professional. And particularly what I want to call to your attention is the implications of the work that we do as healthcare professionals, nurses, physicians, therapists, and how that work really can interfere with the quality of our sleep health. Many of you guys work shifts, right? And most of us work shifts, whether they're 8 hours or 12-hour shifts. It can wreak havoc with our sleep health. If you're a day shift worker, generally the things that can impede your sleep are not necessarily related to working the shift in and of itself, but how you manage the workload, some of the emotional distress associated with the work, and how you balance that with your sleep hygiene routine. Okay, so strictly day shift folks, those are the things that you need to be cautioned about. I'm so sorry, let me shut that up. With regards to work and sleep. But again, most of us don't work just day shift, right? We rotate. We either rotate days, nights, day evenings, 12-hour shifts, and that sort of thing. And that's where it can really get challenging for us as healthcare professionals. We know from the research that when we have a period of time that is less than or equal to 11 hours from the end of the shift that we just worked and the beginning of our next shift, our sleep is impaired. The quality of our sleep is impaired. And what does that mean? Well, it means that we are more likely to get drowsy on duty. We increase our risk for errors. Our psychomotor skills can be impaired. So it's a big deal. And we really need to pay attention to that, not just as individuals and professionals, but as organizations at large. Here in the United States, we've got the American Nurses Association and the Joint Commission, which is an accrediting body here in the US, which mandates that there's collaboration between healthcare professionals and organizations to really manage the sleep demands of the clinicians. From a health perspective, but also from a safety perspective. And actually the Joint Commission goes so far as to say that there should be naps scheduled into the off-shift routines. Now, as I say that, I know that there can be some controversy about how folks feel about their colleagues napping on shift. Now, certainly there needs to be structure around this. There needs to be expectations and equanimity around this. But in the research, when we look at the effect of night shift napping on performance and safety, it's dramatically improved. And not just in the on-shift psychomotor activities and that sort of thing, but also the challenge that many night shift workers face, driving drowsy. And if you remember the video from Module 1, driving drowsy can be as detrimental or as hazardous as driving under the influence. And so, setting up maybe some type of a nap routine for folks that have that commute, that are saying that they are drowsy, and making it acceptable, right? Endorsing this and recommending it, not shaming or shunning people that choose to do the nap. And certainly creating a milieu for the napper that is conducive to an effective, refreshing nap. You don't want to have them sitting in a corner, curled up in a ball on a chair, trying to, grab some Z's. That there really should be a designated area where folks can take the nap and then, have a process for helping them overcome that sleep inertia. When you first wake up, you can feel a little bit like sometimes even worse, but then, you get back into your groove. So just creating a process within the time constraints. They saw benefits in naps that ranged from 15 to 30 minutes. So, being creative around this is really, really helpful. And then the other piece that I mentioned is the psychological effects of our work and how that can disrupt our sleep. Disengaging or detaching from the emotional work, like on our drive home, kind of I think about transitions. When you're coming off shift, you really need to leave work at work and start to transition into now your home role and what that looks like. And also just the high acuity and high intensity of the work that we do, particularly in neonatal intensive care. We can really ruminate on a lot of, things that have happened, maybe some of our decisions and choices and that sort of thing. And that can also adversely affect our sleep. And so again, adopting habits that can help you release that and then get back into your sleep hygiene routine are strongly recommended. And I'll chat a little bit about that in some future slides. This was a really interesting paper that looked at the prevalence of frequent health complaints in nurses. And if you look at the graph on the left, you can see that the top 4 are really specifically related to sleep health, with the number 1 being sleeplessness and a lack of rest. The second one, feeling tired, then nervous, trouble falling asleep, and actually you can even introduce tension headache, which is also a consequence of poor sleep. So, and the thing that's funny about these things, well, it's not so funny, right, is when you realize that you're tired but you can't fall asleep, you actually get more anxious and trying to force yourself to go to sleep. And when you do that, what's happening is you're activating a stress response, and a stress response will definitely undermine your ability to fall asleep. So being aware of this, but also hopefully taking that really critical message from the video on Module 1 to heart, that not getting enough sleep will literally kill you, right? It will literally increase your risk for cardiovascular disease, increase your risk for cancer. And we know that in our field, in healthcare, we are at higher risk for lots of health compromise due to the nature of our work, the disruptions to sleep, and other aspects of our self-care that we often will not pay attention to. I want to just kind of bring you back to the dimensions of sleep health, because on the next slide, I'm going to show you how you can assess your own quality of sleep. Now, remember, sleep is not just one dimension. It's a multifaceted, multidimensional phenomenon that is designed to restore and refresh, right, your body, heart, and mind. And so we need to look at this holistically. But sleep duration really does play a big role. And this is really looking at the total amount of sleep in a 24-hour period. So if you don't get a lot of consolidated sleep in one block, how do you make up that sleep debt? Are you good at taking naps? Particularly for night shift workers, sometimes we may come home and we can take a nap for maybe 3 to 4 hours and then we're up. And sometimes when we're up, the daylight, the activity just keeps us going on. But if we can build in a routine where maybe we're up for a few hours and then we take a dedicated follow-up nap prior to preparing for our work, really being mindful about how you're going to preserve your sleep health is really a key component. Continuity and efficiency of your sleep, that's the ease of falling asleep. And if you wake up, like you have to go to the bathroom or something, are you able to fall back to sleep? The timing, and this is really about the night shift or the shift workers in general. It's where is the sleep placed within the 24-hour day? Folks that sleep at night, you've got Mother Nature on your side, right? Because it is dark, it tends to be more quiet, which is conducive to sleep. But folks that have to sleep during the day, it's up to you to really create that environment that's going to support your sleep. And then, alertness and sleepiness, the ability to maintain attentive wakefulness, which really speaks to the restorative component of your sleep experience. And then the subjective assessment of, was your sleep good or was your sleep poor? And so these really smart people out of the University of Pittsburgh here in the United States developed this very user-friendly sleep assessment scale called the SATED scale, which is basically a mnemonic for satisfaction, alertness, timing, efficiency, and duration. And it's a very simple score here, with the higher numbers suggesting a higher quality of sleep and a lower numbers really speaking to compromised sleep. So for me, I would recommend getting a baseline of where are you at with your sleep health. And then once you're able to identify that, really start digging in to find out how can you optimize your sleep health in a more deliberate and proactive way. Lots of different infographics about sleep hygiene. I'm sure there's a ton of them over in the UK that you can also tap into in other parts of the world where you're located. But in general, sleep hygiene really revolves around having a regular sleep schedule, really setting the clock literally on when you're going to go to sleep. and when are you going to wake up? I actually do set that on my alarm. I'm not awesome at being mindful of it, but certainly, kind of revisiting this research has really reminded me that I need to be mindful about protecting my sleep. So it's really, and it's being consistent. If 9 o'clock or 10 o'clock or 11 o'clock, whatever, PM or AM, whatever, is your bedtime, you have to keep to it, right? Because it's really about creating rhythms within your routine, biorhythms within your routine that align with your circadian rhythm, align with your homeostatic diurnal rhythmicity. And that really helps optimize your sleep and health and wellness. A relaxing bedtime routine. What do? You shut the TV off, you get up, maybe you put your jammies on, you brush your teeth, you wash your face, maybe you meditate, maybe you do a little yoga, maybe you do a little reading, avoiding stimulants for sure. And you guys know who's more sensitive, to stimulants than others, but in general, avoid it. But also alcohol. We don't usually think of alcohol as a stimulant, but actually what it does, you do feel drowsy. It does have a depressant effect on you, but it actually undermines the integrity of your sleep architecture. So you may fall asleep easier after a glass of wine, but it's not going to really support your quality of sleep. Create a good sleep environment, right? So if you're sleeping during the daytime, have room darkening shades. Use a mask if you want earmuffs, or close the door. Playing very quiet, soft music or some type of ambient sounds can really be helpful. And we had a great discussion over in Elgin about sound baths, or I listen to binaural beats from Spotify. I have a focus track, and then there's also a sleep track. So, looking at these and test them out, see what works. It's really about creating that routine. I mentioned blocking out noise and light. Also a very strong recommendation is use the bed for sleep and intimacy. We used to have a TV in our bedroom. Worst thing that you can do, because it really blurs the lines in your sleep hygiene routine. So we got the TV out of the bedroom. So the bedroom is for sleep and intimacy, and really, protect that space. Other recommendations around electronic equipment: don't have them near your bed. Don't have that phone. If you are addicted to your phone, which it's so easy to do, don't have it on the windowsill or the table right next to your bed. Put it, if it's your alarm clock, put it on the dresser on the other side of the room, right? Really create that space that's going to help you. A regular exercise routine is brilliant and really is, supports optimal health. But the recommendations are: don't do exercise before you're going to bed within, a couple of hours. Although going for a nice walk around the block could be a nice way of kind of, down regulating your stress and your activity. Not a vigorous walk, but just a casual, comfortable walk as a part of your routine for bed. And then eating well. There was some really interesting research out there that talked about the link between diet and disruptive sleep. Unbalanced diets with high fat, high processed food can actually impede and interfere with healthy sleep and the quality of your sleep. So again, it's just really, it's being smart and being, proactive about your self-care. On the job, just some other suggestions. I talked about this at the beginning, but, explore napping, in a structured way. What does that look like? And the nappers can't be in the same space as the people that want to have a coffee and a chat, right? I mean, it's not being respectful of the needs of either one, and somebody's going to suffer. And that's not really the point of this. So identifying a dedicated space. Is there a patient? And of course, I always recommend testing things before you actually dedicate a space for sleeping. Say, maybe we could use this room, and try it out for a week, and then have people give you the feedback so that you really making a thoughtful strategy, right? Going to implement a thoughtful plan. Light showers or bright lights is really helpful. Now in the NICU, we have to be cautious, or any care environment really, because if we're working nights, our patients, whether they're adult or babies, are generally asleep or resting. And so bright lights for us can actually impinge on the sleep experience of the patients. So, being smart about that, maybe going into the coffee room where the bright lights are on and kind of getting a dose of light that really is going to reactivate your suprachiasmatic nucleus and wake you up. Maybe a quick burst of activity, run up a flight of stairs. That'll also kind of jazz you up. Now, these are, there's kind of a short effect of these, but they may kind of help get you over the hump. And then if you have a long drive home, go into the nap room, take your power nap, then have your cup of tea or coffee, right, to, overcome the sleep inertia so that you're safe driving home. But also, it's not just about the sleep management on the job, but it's really optimizing your sleep routine at home that's really going to help create a balanced experience for yourself. You're doing amazing work. It's really, really important. And you, your patients and their families really deserve your A game. And your A game is really cultivated by optimal sleep hygiene and optimal sleep health. Here are a few of the resources, and if you have any questions, please sing out. I'm always available, mary@caringessentials.net. And as always, guys, take care and care well. Thank you so very much for your attention. Bye.